Hey, it's Dr. DeCubellis here, and I wanted to go over exactly what causes pain when we have a herniated disc. Because we all hear herniated disc and just think, okay, well, that's going to be painful. But I want to make sure we understand why that's painful. Because when we look at a herniated disc, there's lots of different factors that can be attributing to the pain that the patient or you experience. It just depends on where that herniation is. So I'm going to use this model so we get an idea of kind of what a herniation looks like, and then we'll talk about some of the factors that can contribute to pain from that herniated disc. So before we go any further, we've got the top vertebra, bottom vertebra here. This red inside is going to be the disc. Over here, this yellow is going to be the nerve that's coming out, and we have the spinal cord back in here, and this is the spinal canal. So when we have a herniation, I'm going to get really close with this. When we have a herniation, and it goes like this and herniates, when that happens, we're going to have pain from there. So let's talk about the different ways this causes pain. You can see that nice big herniation. Well, in this case, when that's being pushed out like that, the first thing is that on this actual disc, this outer part of the disc is innervated by nerves. So those are going to cause pain. That's the first pain generator. Now next, in this case, as it's going out, see how it's moving that nerve? So we're putting pressure over that nerve. That's going to be another pain generator. Depending on how much pressure it puts, depends on how much pain and where it's going to go to. Now, let's say the herniation actually goes central. Now when we look in here, we have the spinal cord right in here, which we'll show you on this side. You can see a little bit better because it's coming up the spinal cord right here. Surrounding the spinal cord, we have what's called a thecal sac. So when the herniation goes into, before it can actually touch the spinal cord, it's going to touch the sac that surrounds it. That also is going to cause pain. So now we've got pain with the actual fibers of the disc. We've got pain with the thecal sac. Then when it touches the spinal cord, we've got pain there. Now watch what happens as we touch the spinal cord. See how it's kind of moving? If that spinal cord moves, and look at the back, if it touches the back, now we have more pain generators because of this back here. So all of these factors are things we have to look at, because not only can they cause pain, but they also can describe where the symptoms are going to go and how severe they're going to be. So this is why it's important to not just say we have a herniated disc, but describe exactly how that herniation is causing the symptoms that the person is experiencing. So I'm Dr. DeCubellis. If you have any questions, feel free to reach out, but make sure you also like and subscribe, because I'm going to be going through more videos just like this.